Excuse me, ma'am.
Yes, nurse.
How are you feeling now, ma'am? Are you better?
It's better, nurse. My stomach doesn't hurt like that anymore, even though there is still a little pain.
Yes, ma'am. It's because the doctor gave you the pain reliever medicine.
Yes, nurse.
Okay, ma'am. Let me introduce myself. I'm Nurse Elga, ma'am. I will replace the doctor to explain about illness suffered by you because the doctor has a patient who has just had an accident.
Okay, nurse.
After being examined by the doctor, it turned out that ma'am had appendicitis. This disease has symptoms of pain in the stomach called abdominal colic. This pain starts from the navel, then moves to the right lower part of the stomach.
What other symptoms, nurse?
Other symptoms such as nausea, no appetite, fever, flatulence.
Yes, nurse. For the last few days, I have had flatulence, nausea, and also don't have the appetite to eat like usually does, nurse. What is the cause of appendicitis, nurse?
The appendicitis usually occurs because the appendix cavity is infected, ma'am. In this condition, the bacteria multiply rapidly, making the intestine inflamed.
Oh, I see.
In addition, appendicitis is also caused by swelling of the appendix wall tissue.
Then how is the treatment, nurse? So that I don't have stomach like that again, nurse.
Well, ma'am, the doctor said that you have to perform a surgical procedure to remove the appendix or what is called an appendectomy. For that, I want to ask for your consent. Do you agree to have the operation, ma'am?
I agree, as long as I don't have so much pain like that, nurse.
Okay, ma'am, I'll convey it to the doctor later and determine when the operation will take place.
Hey, nurse.
If so, excuse me, ma'am.
Hey, nurse.
Good evening, ma'am.
Good evening, nurse.
I'm sorry, ma'am. I disturbed your rest time, ma'am.
It's okay, I cannot sleep, nurse.
How are you feeling now, ma'am? Do you still have pain in your stomach?
Still, nurse, but there was little and not pain.
Alhamdulillah. Okay, ma'am. I'm here to convey the problem of the operation, ma'am.
Yes, nurse. How is going, nurse?
After I asked the doctor earlier, the doctor said the operation will be carried out tomorrow morning around 9 a.m., ma'am. For that, you can pay the administration fee tomorrow morning around 7 a.m.
Okay, nurse. I'll get my daughter to pay for it tomorrow morning, nurse.
Well, thank you very much, ma'am. Then I'll excuse me, ma'am. Have a good rest.
Welcome, nurse.
Good morning, ma'am.
Good morning, nurse.
Are you ready for surgery, ma'am?
I'm ready, nurse.
Okay, ma'am. Me and the other nurses will take you to the operating room. Previously, did you pay the administrative fees, ma'am?
Yes, nurse already paid by my daughter earlier.
Okay, ma'am. Then we ask permission to take you to the operating room.
Okay, nurse.
Alhamdulillah, ma'am is aware. How are you feeling now, ma'am? Is it a little better?
A little better, nurse, but still a little pain around the stitches.
It's okay, ma'am. That's because the stitches are not too dry. In a few hours, the stitches will be dry, ma'am.
Okay, nurse. Thank you very much, nurse.
You're welcome, ma'am. Then, ma'am, just take a break and don't forget to take your medicine, ma'am.
Yes, nurse.
Then, I'll excuse me, ma'am. Have a good rest.
Yes, nurse, thank you.